Many people struggle with stubborn fat despite diet and exercise, often turning to invasive surgical options like liposuction or the latest trend of GLP-1s, both of which come with some level of risk. But now, a revolutionary laser technology is changing the way we can address fat loss, working with the body at a cellular level to deliver real results naturally.
I finally decided that I was going to go ahead and do something for myself. I was in my 50s and I figured now was my time. So I went online and did searches to see what would be something that could work for me and help me achieve the goal. But what stood out for me was Dr. Lara's videos and his information on the value behind this green laser treatment.
So the technology of the emerald laser therapy, which is a low-level green laser, is very, very different than most other approaches to weight loss. And so what we're really doing is, rather than getting rid of the fat cells, we're actually converting those fat cells through this technology into healthy fat cells, which are part of the endocrine system and are ready to help us become healthier each day.
I've lost probably 35 pounds and my inches have been fantastic. I've probably lost close to 10 inches, enough that it's changed my life and in such a positive way. But most importantly, the mental change in myself, the emotional change in myself, and the positive ways I now see myself again and feel the health benefits. It's an amazing investment in yourself.
Joining me now is Dr. Cesar Lara, who currently uses this technology on patients, as we just saw, and Joseph Zapolsky, the International Sales Director for Erchonia, the maker of the Emerald Laser. Thank you both for being here. I'm so fascinated by this. How did you find out about this?
So I'm an obesity specialist, and so I was at an obesity medicine conference, and there was this show that was being given by Erchonia that was saying we can actually release all this fat, and I'm thinking, oh, sure.
Of course.
And then once I started looking at the studies, I was able to then jump in, and I've been using it successfully for a good 8 years, helping lots and lots of patients successfully release weight.
How does it work?
So it's a pretty amazing process. What it does is the green laser has a photochemical reaction with the body. So if you picture the fat cell, the green laser hits the photon receptor on the fat cell. Once that happens, that photochemical reaction is a small pore created in the cell membrane.
So it's like you're poking a hole in a balloon.
Exactly. So what we're doing is converting a diseased fat cell into a healthy fat cell that now can become an integral part of the endocrine system to create the good things that we want.
Right. How many times do they have to be treated?
Typically, the recommendation is an average of 8 times, where the studies have clearly shown that with 8 therapies, you can release an average of 6 inches of actual volume, or meaning fat reduction.
It almost sounds too good to be true. Is there a limit to how big somebody could be to undergo the laser?
No, there's not. When we first started doing studies for non-invasive fat loss with our lasers, it was just a 20 to 30 BMI. So your average body weight, looking just to kind of cosmetically be sexier, feel better.
Yep.
But then we said, okay, we want to take the emerald laser and do a study, which we did with obese patients, 30 to 40 BMI, to see if we could help people that are dealing with what's become an epidemic. And when we did that study with the higher BMI, it was just as effective. So we're able to offer a non-invasive option to obese patients as well.
Thinking cosmetically, is it just abdominal, or can you put it on the neck or the arm? Are there other places you can direct it?
Absolutely. So as we did studies with the lasers, we have done studies with the arms. And because we had shown with the lasers we lost fat in different areas of the body, with that you're able to treat the back fat underneath the bra line, very popular with women, waist, hips, thighs. We've even seen people doing legs or calves.
Any downside? Anything you worry about?
No, that was really the significant thing about our company that we've always strived for, is to make the safest products, because it really started with our 2 owners, and they were building a pain management laser for their father. So being that it's going to treat their family member, safety, effectiveness is of the utmost importance, and they carried that mantra through as we grew the company. So in all of the level 1 clinical studies we've done, Dr. Drew, we haven't had a recorded side effect or adverse event.
Well, gentlemen, thank you very much. I know I want more information. I suspect you do too. So visit Emerald Laser, L-A-S-E-R, lasers spelled with an S, emeraldlaser.com to find a provider near you. Check it out now. Don't go away.